Okay, I'm going to go through a quick tutorial on your upcoming assignment for your comp exam on a peer lab. So in Canvas, you'll notice there's two assignments due, your typical Qualtrics assignment and then your radiographic interpretation. So radiographic interpretation, we're going to pretend that we have a comp exam coming up and we have images in the system already that we can look at before the patient's even here. So let's just pretend this is your patient that you're going to be seeing for your comp exam lab. We're going to click here on the assignment. This is going to open up, and basically this sheet just gives you instructions that I'm about to give you now. So there's two links. One is Axiom Training. So you're going to want to make sure that you log into Axiom Training so that you have access to the radiographs that you'll be using. This is not going to be your partner's images. This class does not have images yet of themselves in Axiom, so we're just using this for practice. And then you can also click here on this link, and this link is going to take you to a Google Sheet where you're going to document your interpretation of what you're seeing in those images that were dropped into your Axiom training chart. So you can click here on radiographic interpretation. If you click and it doesn't open, then I want you to right click, go to open link in a new tab, and then that tab opened up right next to it. So I'm going to click there. I'm going to click make a copy. So this is going to make a copy that automatically saves into my Google Drive, meaning your Google Drive. You're going to highlight copy of radiographic interpretation here at the top, and you're going to rename it with your last name underscore and then your class year. So I'm going to put rep underscore 2028. On this sheet, it says chart number. I want you to ignore that. And then here we've got all the tooth numbers, and then existing restorative goes in this column and pathology goes in this column. Then we're going to go over here. We're going to open up Axiom training. So somehow I am not in training. Don't know how that happened, but I'm going to go out of there. I'm going to go to my apps. I'm going to go to Axiom training here. And at the top, I'm going to type in my own last name. So each of you are going to type in your own, pull up your fake charts that you created at the beginning of the year. You should only have one chart. I did notice as I was loading these in, there are a couple students that have two charts. You'll probably have to click in both of them to see where you can find the images. So I'm going to go to imaging. And then some of you will already have images in there because you've been practicing in the Dexter lab. That's okay. You're going to look for the images that are specifically titled Comp Exam on a Peer Lab. You should have an FMX and capture date is April 1st, and then you should have a PNO. You can use both of these to fill out that radiographic interpretation that we just opened up. So if you want to, you can look at the pan first. This gives you an overall view of the patient's mouth. You can go through and figure out which teeth are missing. You can look for any pathology in the mouth here, and then you can document any of that in that sheet that you made here. If you don't see anything, then you can go back. You can click on images, and now we can go into the FMX. So basically, you're going to go through each image, and you're going to put down if you see in that first column is going to be existing restorative. So I'm going to use the PAs to kind of look, but it's kind of hard to tell. So now I'm going to jump down to my bite wings. Sorry, I've got to move my toolbar, which I don't think you're seeing, just out of the way so I can see better. So here, it's kind of questionable. There might be an occlusal composite here on tooth number 2. If you remember, this was the third molar, second molar. Sorry, I'm backwards. So our third molar here, our second molar, and then our first molar was missing. So I don't see anything on tooth number 1. However, there is some overlap here. But when I go to my premolar shot, my premolar bite wing, now these contacts are open and I can see just a little bit of darkness on tooth number 1 on the mesial there. So one might not want to document that, but I personally like to document absolutely everything that I see so that I can train my eye to look for everything. Then when my patient comes in, I'm going to check clinically. I'm going to go back and see with my explorers, this area soft. How does it look in the mouth? Can I see anything at all? And then if we're getting a lot of these incipient areas as we go through, that might be a red flag to us that we talk to our patient about nutritional counseling, oral hygiene, and fluoride, because we're not just putting down what we need to restore, but we need to remember that we also need to set our patients up for success on how we can prevent moving forward or stop and arrest some of these areas. So I am going to go ahead and put number 1 down. So on tooth number 1, I'm going to put for restorative, nothing. And then on pathology, I'm going to put RL for radiolucency, and then I/O for indicative of, and then M for mesial caries. Okay. Then I'm going to move on to tooth number 2. We saw that there was a radiopacity indicative of occlusal composite. Okay, so RO meaning radiopacity, and then that composite looked like it was on the occlusal. If you're unsure, put what you think, and when the patient comes in, you can always confirm clinically. And then I put composite because it's not super radiopaque like amalgam is. It's more of like a lighter radiopacity. So now I'm going to go back to my images here. And if you notice right down in this area, if you came in and this image was blurry like this, you can click these 4 lines down here and it will sharpen the image. Other things you can do is just click on your mouse and then move up and down to change the brightness and the contrast, or you can go to this circle, click on it, and then you can adjust the brightness here and your contrast here. And you can see when you do that, some areas like these interproximal incipient lesions might be more obvious to your eye. Another thing to think about is to turn the lights out behind you, because sometimes that will draw your eyes in a little bit better as well. And then when you're done, you can click reset to default. So now I'm going to go back to my sheet. I'm kind of unsure if there's any occlusal composite in there. I'm kind of thinking no, so I'm going to leave that. But I am going to add in these radiolucent areas. So number 4, oh, we got to put in missing for number 3. We mentioned that earlier. And then number 4 was RL, indicative of mesial caries, and RL, indicative of distal caries on number 5. Okay. And then you'll go back and you'll just continue to navigate through all the radiographs. Make sure you use your bite wings and your PAs. There's different angles where you can see things differently. You also want to make sure that you're checking for any periapical radiolucencies or any pathology. If your patient has attrition, it's going to be described as RL. And the reason why we might document attrition is because if you're noticing a lot of attrition, your patient comes in and it's pretty severe, that's something that might red flag you to consider talking about a night guard or some type of protection from getting more and more tooth wear as the patient ages. And then also if you see radiographic calculus, you can document that as well. Anything you document, again, is going to be flagging for a conversation with your patient when they're in the chair and for better treatment planning. So go in, complete this to the best of your ability. This is not graded based on being right this time because it's so new with your lecture just recently with Dr. Shackelford. It's basically just getting you into the practice of looking at images, making notes before your patient even comes into the clinic, and being able to describe what you're seeing, and then also getting you into the routine of kind of systematically working through these images. So completing these or this assignment and submitting it on time is 1 point towards your progress exam that you have in the lab with us, but it does not dictate the grade based on if it's right or wrong. So just work through it the best you can, make sure you complete it on time. And then the TAs on the day of lab will be showing you what they do with this information once the patient's in the chair. They'll show you how to create a hard tissue note and how you document radiographic versus clinical findings. So good luck with the assignment. If you have any questions, as always, make sure that you reach out. You'll screenshot that Google Sheet when you're done, when you've completed all the columns, and then you'll submit that through Canvas. And that is all for the instructions.